A 59-year-old male is diagnosed with chronic pancreatitis, suffering from severe pain and weight loss. He is narcotic dependent and has failed all medical treatments, including endoscopic stenting. The pancreas is extremely atrophic, showing significant calcification with irregular narrowing of the pancreatic duct. A total pancreatectomy with splenectomy and Islet auto-transplant procedure is planned. The proximal duodenum and the proximal jejunum will be divided. The common bile duct will be divided. To maximize the arterial flow into the pancreas and preserve the islet functions, the major vessels will be kept intact during the pancreas dissection and not divided until right before the specimen removal. The uncinate process will be mobilized and dissected off the superior mesenteric vein. The gastroduodenal artery and splenic artery will be divided, followed by dividing the splenic vein. The specimen will be removed and sent to the lab for pancreatic islet processing. The pancreas will be extracted from the specimen, cannulated, and distended. Pancreatic tissue will be digested in a Ricordi chamber to release islet cells. The purified islet cells are collected in an infusion bag. The bowel is reconstructed as the islet cells are processed. A catheter will be placed into the portal vein, and the islets will be infused through the catheter into the liver. Once the islets establish the vascular connections in the liver sinusoid, they will start to produce and release insulin post-operatively.